Thank you for joining us today for this MDA Engage Education Seminar. We are thrilled to have Dr. Margot Braylin here to really kind of talk with us about genetic testing. Dr. Braylin is an attending physician at Children's Hospital at Montefiore and an assistant professor of pediatrics at Albert Einstein College of Medicine. Since joining the Montefiore team, her clinical focus has been inborn errors of metabolism, including lysol storage disease. Dr. Braylin's research on clinical outcomes in patients with inborn errors of metabolism and lysol storage disease naturally follows from her clinical focus. Her work has been published in a number of peer-reviewed journals and abstracts and has been nationally presented. So with that, Dr. Braylin, I am going to stop sharing and let you share your screen and take it away.
Thank you so much for that kind intro. Okay, just 1 minute. I'm going to share my screen. All right. So as we were saying before, my name is Dr. Margot Braylin. I'm a clinical geneticist at the Children's Hospital at Montefiore. And I have been privileged to take care of a number of the patients that Dr. Delfiner and her team take care of at the MDA Center at Montefiore. So my hope is today that we can talk a little bit about what genes are and what genetic conditions are, where they come from, how genetic testing is performed, the types of results you can expect to get, and what some of the pros and cons are of genetic testing. Genetic testing is great for some people and not so helpful for others, and it's a very personal choice. So I'd like to give you the basis of information to understand whether it might be right for you or your family. So let's start from the beginning. What are genes? Well, we don't have to get into the science too much here. I would like you to understand is that genes are very much like a recipe. They give the instructions for the body. And so just like a recipe book might show you how to make cookies, for example, genes tell our bodies how to make proteins, and proteins have important jobs to keep us healthy. So if you look at a cell, our bodies are made up of many, many, many cells. Inside the cell, there's this thing called a nucleus, which is really just a container of genetic information. And that's a lot of information. It's this really long string of information and code. And so in order to make room for all of that information, it's packaged into these things called chromosomes. And if you unwound those chromosomes and looked more closely at their content, there would be a bunch of genes lined up, and each gene has its own job and contributes to your healthy body in its own way. And if you zoomed into those genes even more closely, you'd see a bunch of chemicals lined up that make the gene work properly. And instead of drawing out these chemicals every time, we give them letter names. And those names are A, G, T, and C. And there's a sequence that we expect to see, a series of A's and G's and T's and C's in each gene. And so we can check to see if that sequence matches. Now, you don't just have one chromosome per nucleus, you have 23, and 23 pairs of chromosomes, actually. One of those in each pair comes from mom, and the other comes from dad. So now that you have a general idea of what genes are, let's talk about what genetic conditions are. So a genetic disorder is a condition caused in part or entirely by a change in the DNA. And the symptoms that you get from that condition depend on the job of the gene, or maybe genes. Maybe there's more than one gene involved that were affected. So you can have a change in the amount of DNA, like, for example, a whole extra chromosome. If you expect to see 2 copies of a very chromosome, but instead you see a third, that's a condition. You can also have an extra part of a chromosome. That's a condition, or a missing part of a chromosome. Other genetic conditions are caused by changes in the genetic code. So remember I said we know what we expect to see in the code because of scientific studies that have been done on people to check their codes in healthy people. Well, you can check the code in a patient and see if that matches up. And if there's a change, then we look into that. So the next topic I wanted to go into is, where do genetic conditions come from, right? Sometimes they're passed down in a family, and that's what patients are usually thinking of when they think of genetic conditions. But sometimes they can also be new in a child or a patient. So a genetic condition doesn't actually mean that it's inherited. It's not always passed down clearly in the family where you see the parents and the grandparents having the exact same symptoms as a child. But knowing how the gene or a genetic condition will be passed down along the family will help us to tell you the risk of other children in the family or other people in the family being affected. This is actually dependent on the gene that's impacted in an individual patient. So I'm going to go over a couple of the possible ways that conditions can be passed down through a family, and some ways where it could also be transmitted through the family, but the child is the first one to have symptoms. But in the case of an individual patient, it's important that you ask your doctor which one of these categories your relative falls into or you fall into. But first, I'd like to make very clear that it's never, ever a parent's fault. So this is not something that somebody does on purpose or transmits in their family on purpose. It's just never, ever the parent's fault. Okay. So I find in my practice that this is the way that most people think of genetic conditions getting passed down along a family. If you're looking at this picture, remember we said we have 2 copies of almost every gene. So they've drawn out the genes here in turquoise. And then they use this word mutation. I prefer the word change. That means a change in the gene with the purple, okay? So this father here has a change in 1 copy of the gene, and that's enough for this gene for him to have symptoms. And so that's why they colored him in purple. And when you have a baby, you pass on half of your genetic material to that baby. So that means just by chance, 50% of the time, his children will be affected by the same condition. And you can see that in this picture here. So this little boy got the purple change in the gene. He's affected. This little girl, same thing. But in the other half of cases, the unchanged gene gets passed on to the children, and they don't have any symptoms. Mom is unaffected, so she's always passing on an unaffected change. Okay, that's called autosomal dominant inheritance. And I think that's the clearest way that patients can see that something's been passed down along their family, but it's actually not a very common type of transmission of genetic conditions. There's also this other type of inheritance called autosomal recessive inheritance. And that's where if you have 1 working copy of a gene, that's enough to not have symptoms. So if you look at this dad and this mom, they both have a purple change, a change in 1 copy of the gene, but the other one is working just fine. And so they probably went through their whole lives not knowing that there was this change in their genes because they're healthy. But by chance, they both have a change in the same gene. And so half the time, each of them is going to pass along a gene with a change in it. And a quarter of the time, that'll happen in both cases. So in 25% of their children on average, a child will get 2 copies with the change, and that child will be affected. So this little boy over here in this picture, he got the changed copy from dad and the changed copy from mom, and he has symptoms. So you can imagine how nobody in the family probably had symptoms of this condition before, but when this mom and this dad came together and made a baby, they had a child with these symptoms. And it's important to know if you have a relative in the family with this kind of condition, because this actually means that for all of the pregnancies with this couple, there's a 1 in 4 chance that they're going to have another affected child. Okay, here's just 2 other types of inheritance that I want you to be aware of. But again, you only need to know which one affects your child or your relative. I just want you to have a general idea that these different types exist so that you can ask your doctor which one it is. So sometimes the sex chromosomes can be affected. Boys have an X and a Y chromosome, and girls have 2 X chromosomes. So since girls have a backup X chromosome, they might not have symptoms of the condition, whereas a boy doesn't have a backup X chromosome. So they are more likely to have symptoms. And so the way that it passes through the family actually can be affected by whether you're a boy or a girl. And then there's this thing called mitochondrial inheritance, where it's a gene that is received only from the mother, and all of the children in that family are theoretically at risk. Okay, so that was a lot of information, but the most important thing for you to understand is that there are different ways that genetic conditions can be passed through a family, and the way that it would pass through your family depends on which gene is affected, and it's worth asking your doctor which one you're at risk for if you have a genetic diagnosis. Okay. The other thing I want you to understand is the idea of variability. So not everyone with the same exact genetic change, even within a family, will have the exact same symptoms. So doctors and care providers can try to predict how a patient will do over time, but this is really challenging and is almost never 100%. So we can never say always or never, even though I just said never. And you should be skeptical if you hear something like that. These children never do this or always do that, because there is always variability, right? Okay. So next, we've talked about what genes are, how they're passed through the family, but how do you do a genetic test? Most often, it's actually just a blood draw. So what's done on the laboratory side is rather fancy, but as a patient, it actually is like any other blood draw. They fill a tube and they send it off to the laboratory. Sometimes this can be done with saliva or a buccal swab. And increasingly, we're starting to do that during COVID times, that we can meet patients online and then send testing that way. And then other times you actually need to do the genetic testing on a skin biopsy or a muscle biopsy. That depends on the actual condition with the patient and their individual scenario. But most often this is a blood draw. So the other thing is, not all genetic tests are the same. So some look at the amount of DNA. Remember in the beginning, I was talking about chromosomes and you can have added or missing bits. That's one type of genetic problem, and it's detected by one type of genetic testing. Others look at the actual DNA sequencing. So that was those little chemicals with the letter names, A, T, C, G, where the genetic testing lab actually looks at that sequence and sees whether it's consistent with what we would expect to see based on a standard. Within that, there's even more possibilities. So you might just look at one gene, you could look at a few genes, or you could look at all of the genes related to a patient's symptoms. The take-home point for this slide is that no genetic test checks for everything. And so it's important to keep track of what was done so that future doctors can build on it, save these records. Okay, so at this point, it's time for me to talk to you about the type of results that you can get. Many tests in medicine have positive and negative results, but genetic testing introduces this possibility of an uncertain result, a question mark result. And we see this more often than we'd like, and I want to explain it to you a little bit. So in addition to a positive or negative result, positive meaning this is a diagnosis for a condition, or negative, didn't diagnose any conditions. you have the possibility of finding something called a variant of uncertain significance. And what that is when there's a change in the DNA, but there's not enough information to determine if it causes symptoms or not. So I told you before that we know the sequence of base pairs of those chemicals, AET, CG, and we can check to see if a patient's sequence matches up with what we expect to see. If there's a change, but it hasn't been reported in enough patients before, it can be very hard to tell whether or not that change actually affects the gene from doing its job. Some changes in sequences mean nothing at all. It's just like a little bit of a smudge in in your recipe book, while others completely change the outcome, the protein that's made. So as geneticists and clinicians, we have a couple ways of trying to sort this out. One is to test the parents. So sometimes we'll ask for blood from the parents so that we can see where the change came from. And depending on the type of gene, that can help us tell whether or not that change in the gene is affecting the gene from doing its job. The other thing is we need to see if it fits the patient. So if it's a condition that fits the patient perfectly, that explains all of their symptoms, I'm more likely to interpret that question mark result as a more likely positive. But if it's full of symptoms that just don't fit the patient, then that's probably more likely negative. Now, sometimes you can do this by just looking at the patient, and other times that requires additional testing, like an MRI or a muscle biopsy. And so this is a time when we work very closely with the other members of the medical team to see what type of testing we might need to do in order to sort such a question mark test result out. And the other thing we can do is time, which can be challenging, but the laboratories keep a record of all of these changes over time. And as more patients come up with the same changes, we can look at how they're doing and see whether it seems to be that that change affects a patient or not. Okay, so one of the last really important things that I wanted to go and talk to you guys about are the pros and cons of genetic testing. But this actually isn't a simple question to answer because it very much depends on who you ask, right? You could ask the patient, you can ask the parents, you could ask the full family, right? So a genetic test result can impact an entire family, the doctors, or society. Today, what I'm really trying to focus on is the patient and their immediate family and what it might mean for them. And even within that, different patients have different values. So let's focus on this inner circle of the family and the patient. So some pros. Well, genetic test results can inform us about the future. So that can help you to understand the prognosis a little bit better, although not with complete certainty, like I said before. It can also help you to understand conditions or symptoms that haven't occurred yet in an individual. So maybe a genetic diagnosis can, it mostly impacts the muscles, but patients may also be impacted in the heart. And so then we know to check the heart. It can help us to understand risk for family members. And that can be family members that might not yet have symptoms, but now we know to test them genetically, or in terms of risk for future children. A genetic test result sometimes offers clarity. If a doctor really doesn't know what the underlying diagnosis is, then a genetic test result can actually be really valuable because then you can have a clear diagnosis when the genetic test offers a clear positive or a likely positive. And as Dr. Delfiner was discussing all of these guidelines earlier, a diagnosis can be really important to know which guideline you should be following. Sometimes it can really be helpful also in allowing families to meet others with the same condition. Even though many of these diagnoses may be rare, I find that the families tend to find each other better than any doctor can, and tend to really connect online and in person, and it creates extra community. The other thing is that sometimes a genetic test result can be required for clinical trials or experimental therapies. And so in order to have access to these types of therapeutics, you might need a genetic test as documentation of your result, a documentation of your diagnosis. So some possible cons, and I've put these in quotes because everybody's pros and cons are different, and what one person thinks is a strength, another might actually see as a negative, as an issue. So before I was talking about the possibility of a question mark result, an uncertain result. So this level of uncertainty can be very challenging for some families. It's not always a clear yes or no. And even if it is a yes, we may not know the severity, age of onset, or prognosis for that condition. The other possible con is bad news. So it might give a diagnosis in a patient with a poor prognosis, and can be very upsetting. And also sometimes genetic testing, depending on the scope, can give you results that were completely unexpected. So a change in a gene that might not even be all that relevant to the reason why you sent that testing, but can have important implications for your health. So that's another type of bad news that's possible. There's also issues with privacy. I would really be omitting something important here if I didn't talk about privacy, right? So genetic testing involves checking for changes in some of our most personal information, our genetic code. And every laboratory is different in how they handle that private information. And if and when you do genetic testing, you will be given a consent form that gives some information about privacy and how that's handled at the laboratory that your doctor chooses. And it's actually really important to read the consent form. This is fine print that I wouldn't skim over. And you should ask questions until the answer becomes clear to you. So New York State, for example, has a rule that you can only hold the actual DNA sample for a certain amount of time. But other states, laboratories are entitled to hold that indefinitely. So you should check and find out what the rules are about that. Other thing is, what happens to the data after it goes to the patient? Is it being held by the laboratory? Is it being used in any sort of studies? Oftentimes, there's actually a check mark that whether or not you are okay with that specimen being used for research. And you might need to check that you are okay with it or not okay with it. So this is a consent form that is important to be read carefully. Another possible con is the cost of testing. So although genetic testing has become more affordable with time, it's one of the potentially more expensive tests that we do in medicine. And so it's important to know about this and ask your doctor questions about it. Sometimes it's covered by insurance, other times it isn't. It really depends on the situation. I also, in terms of privacy, wanted to talk to you briefly about something called GINA, which is the Genetic Information Non-Discrimination Act. And so this is relevant to Americans. It's a protective act that protects Americans from discrimination based on their genetic information in health insurance and employment. So that means that health insurance cannot exclude you on the basis of a genetic diagnosis, and your employer can't make employment decisions on the basis of that. But GINA could easily be overturned, so you have to think about what it would mean to you if that protection didn't exist. And importantly, there's a hole in this act, and that is life insurance. So life insurance companies actually can ask for your genetic information. And sometimes I'll advise patients to explore life insurance options before completing genetic testing. It depends on the case. So next we say, do I have to get genetic testing done? And I hope at this point in the talk you understand that answer is a strong no. You don't have to. So every individual family has different opinion on what they want to know about their genetics and how they would respond to information. And you could have the same result and it could be received very differently between families. So this is a personal choice with advantages and disadvantages. And it's not mandatory, it is up to the family, and there's not a clear right or wrong answer. So the hope is that with informed consent, what we can do is take an individual family or patient's values, beliefs, and goals, educate them about the risks and benefits of genetic testing as they relate to those values, beliefs, and goals. And then that family makes a decision about whether they proceed with testing. And some families are very excited about the opportunity of coming to a genetic diagnosis, and other families feel this is not right for them. That's what informed consent is. That's sitting down with your doctor or healthcare provider to make the right decision for you and your family. So lastly, I wanted to give you a little bit of information about what you might ask if a genetic test is being performed on yourself or a relative, because I know that I just gave you a lot of information, many of which pieces could vary based on the circumstance. So some questions to consider asking your provider. You should know what's being ordered and what is and isn't being tested for. As I said, no genetic test checks for everything. So you should know what's being checked for so that if down the line you want to do more testing, you kind of have a sense or records of what was done and what hasn't been done. You should have a sense of the various results the test may show and what each might mean in yourself or your relative. So kind of ask the provider in advance, if we get an uncertain result, how might you go about that? And what's the likelihood of an uncertain result? Sometimes we can give you an estimate. If it feels like a patient fits very well into an individual condition, the likelihood that that result's going to be interpreted as uncertain is lower. Also, the more tests you do, the more genes you check in an individual test, the more likely there is that you'll find an uncertain result at some point in that testing. So as we've kind of said already, the risks, the benefits, and the limitation of that specific test. Also, what about the chance that the test will find other information unrelated to the reason for testing? So some tests give the option for you to look for future cancer risk, even completely unrelated to the reason for genetic testing in a patient with muscular symptoms. But because the testing is being done, the family is offered these other genes to be analyzed that offer risk information for unrelated conditions. Also, for some of the bigger testing, it's possible to find information about non-paternity. These are things that you should inquire about and know, and that goes down to the scope of the genetic testing. And also, just a general idea of which family members the results might affect and who might be offered testing next. Do you need parental blood samples now, or is that something you might do down the line? And when I was talking about privacy before, it's worth knowing where the sample will be stored and what other testing can be done on it, okay? And if your provider doesn't have the answer to this question, it's okay to pause and look into it either on your own or have them look into it for you. How much will this test cost me? Sometimes that means a conversation with the insurance company before the testing is ordered. Okay. There are also some questions you should consider asking yourself, right? Before I was talking about questions to ask the provider, but this testing very much involves understanding your own beliefs so that you can kind of get a sense of what's right for you or your family. So try and think about how you might feel when you get the results. What would a positive mean? How would you feel about an uncertain result? Is that something that would really bother you, or you kind of feel that with a good relationship with your doctor, you'll be able to navigate that? You should also think about where you'd like to get the results. This is something that I try to talk to my patients about beforehand, but I really appreciate it when the patients have also thought about it. So do you want to get them in person no matter what? That's okay. Then just ask for a follow-up to get the results. Other patients have a lot of difficulty coming into the office and would appreciate a call, a phone call instead, but want to make sure they're with a partner or someone else. And then if you have concerns or hesitations about the testing, that's something you should think carefully about and try to verbalize to the provider when it's being offered. Okay, so at that point, I'd like to open this up for questions because I know that that was a lot of information. I hope you found it helpful.
Wonderful. Thank you so much, Dr. Braylon. I thought that was a wonderful presentation. Thank you for sharing all that information.
No problem.
As a reminder, feel free if you have any questions for Dr. Braylon to go ahead and type them in the Q&A box, which is located at the bottom of your screen, and we can get through as many of them as possible. We did have one question that came in, and I think the question was around, is there a reason that someone should do more than one genetic test? I think that there is some questions about that. And I know we've heard too some questions around that. If you've had a genetic test, say 10, 15 years ago, if it was that variant of uncertainty, like, is there a reason someone should redo a genetic test?
Yeah, absolutely. There are times. So do you mean add another test or redo it? Or both?
Either or. Yeah, either or.
Okay, so since no genetic test checks for everything, then absolutely there are times when you should kind of broaden your horizons and test for more things, especially as a patient's symptoms evolve over time, because even the big test that we think of, which is exome sequencing, where you check all of the genes in theory, the computer filters those genes based on the symptoms that a doctor reports. So if a patient's developing new symptoms, that might open up a whole new set of genes to check for changes in. And then over time, the technology's improved dramatically. So some of the older patients who had testing maybe as younger children, if it's been even over the past 3 to 5 years, the testing has evolved completely. So it's very possible that there is a change in the genes and it was missed, or that the correct testing wasn't ordered to detect that change.
And I think, Dr. Braylon, if I heard you right, is it accurate to say that if someone has ran a test and had a test, if they did need to have a retest done, is it possible that they would use that original sample, or would they go through that whole process again?
It very much depends. So in New York State, for example, they have to get rid of that sample after 60 to 90 days. But in other states, they can hold the sample. So it depends on what the patient agreed to. But the laboratory, so if we get one of those question mark results, like the variant of uncertain significance result, the laboratory actually will reanalyze. They don't need a new sample. They can reanalyze that data every year or 2 years, if you call them.
Okay.
So it depends.
Yeah. No, that makes sense. That makes sense. I know too, I think I saw on your screen you mentioned cost, which I think is something we at MDA hear about as well. Is that something that patients get that information up front before running a test? Is there support programs for folks if they need a genetic test and it's not covered?
Yeah, so hopefully it's information that's obtained in advance. It often requires a prior authorization. Sometimes the provider doesn't know to think so carefully about costs in advance because they're used to being able to order whatever's clinically indicated, and genetic testing is a little bit different in that way. So I think it's smart for the patient to really ask about it in advance, and make sure that that answer is clear from their insurance company before it's ordered if cost is a concern, because these can be very costly tests. I also think Dr. Delfiner wanted to add something about genetic testing supports through the MDA. So if she's around, she can hop in and mention that.
Just remember that when you come to your MDA care center, depending on what disorder or what type of disorder we're thinking about, the MDA does have partner programs to support certain testing opportunities. So even if you assume that you are underinsured or that you don't have coverage for it or that it would be wildly expensive, know that for certain disorders, there is low or no cost testing option. And so don't be afraid to bring it up. Your MDA care centers also know how to work with different labs in terms of compassionate care pricing and discounted pricing. And so it should always be a discussion. Don't let the fear of cost stop you from asking the questions. Dig in with your doctor because there may be an option for you.
Perfect. Thank you. Yeah, it is very important. And I think as more and more treatments are, coming down the pipeline, which is very exciting, being able to ensure that genetic diagnosis too becomes important. So it is important to look into that. So thank you for sharing that, Dr. Delfiner.
There are actually some of the pharmaceutical labs that are offering some of these more novel therapeutics will offer testing for free as well. So there are lots of workarounds. You just have to pause and say, let's explore these workarounds before going for the testing if it's something you're concerned about.
Yeah, perfect. It looks like our next question is, I have a confirmed myotonic dystrophy diagnosis. My granddaughter has multiple symptoms involving muscle, speech, intelligence, etc. She tested negative for myotonic muscular dystrophy. Now we don't know what she has. How can we get help for her?
So this is one of those situations where it would be very clear if they had tested the granddaughter for the exact same condition and there was a clear positive, that would be very helpful and we would know how to go. But it's very possible that she has a different condition. And so if testing for myotonic dystrophy was negative, I would suggest starting with a clean slate and bringing her to a geneticist and other doctors to try to evaluate what her symptoms are. So it's possible that she has a different genetic diagnosis, unfortunately.
Perfect.
Dr. Braylon, how can patients get to a geneticist? Is that something that pediatricians refer to? Can patients come to you directly?
So that depends on insurance again. Usually we get referrals either from pediatricians or neurologists or other subspecialists. Sometimes that referral is required. But some patients come to us directly. And I think actually with COVID, it's a little bit more easy to get accessible care because of telemedicine as well. So even if there's not a geneticist in your healthcare system, you might be able to reach one outside of that system now because so many of us are doing telemedicine. So ask and I'm sure somebody can get you there with the right tricks.
Yeah. And I think one of the other things that we hear from families too is sometimes they maybe get the test, but they don't go back in and get the results or get them interpreted. Can you share why that's important that those results are shared back with families from a professional who's really trained to understand and read those?
Yes, absolutely. So before I went over, for example, the different ways that a genetic condition can pass through a family, right? And during consenting, usually the provider will talk about all those possibilities. But once you get that result, it's really important to rehab that conversation so that you know how the condition actually impacts your family. Because there's so many possibilities. And really, a genetic diagnosis usually means only one of those possibilities, and we can guide care on that basis. Geneticists are trained to understand these results and also navigate uncertainty and put together the clinical symptoms with the test results. That's what we specialize in. We're a lot like investigators in that way. And so I think it's important to go to somebody who can really explain this to you in a way that makes sense to you and can put all the pieces together as they make sense to your family and that one patient. So those results are valuable and understanding them is essential. Patients are really the bosses of their care in a lot of ways, right? They carry that information with them. And so I think it's really important that a patient fully understand that result so that they can inform other providers who might not have as much experience.
Yeah, that's very true. And, you know, to Dr. Delfiner's point earlier about kind of having her care binder too, do you recommend folks, once they get those results, that they do include those in, say, their care binder for future reference?
Yes, absolutely. So they should keep those results in there also, because some people might say, I already had genetic testing, it was negative, right? And that is very challenging actually, because then we don't know what was done already and what we can build on, because there's always something you can build on. Within a few years, something new has come out. So positive or negative, keep it with you. Save it. I actually recommend take a picture too and scan it into a computer so you have a couple copies. And bring that binder with you to your genetics appointment, because we're investigators. We want to know about every little symptom so we can get as close as we can to a clear answer. We read through all of those records, so they're valuable to us as well.
Wonderful. Perfect. Well, Dr. Braylon, I think that's all the questions that we have time for today. Thank you so much for spending part of your Saturday with us and sharing that important information.
Thank you.